introduction, my name is Brendan Cahill. I direct the Institute of International Humanitarian Affairs, which is an independent center that reports directly to the president of Fordham University. We act as a bridge between the humanitarian and the academic sectors, and we do this mostly through training, graduate training, through our graduate programs, the Master of Arts in International Humanitarian Action, and the Master of Science in Humanitarian Studies, and through our undergraduate trainings and our majors and minors at both our Rose Hill and Lincoln Center campuses. In addition, we have our own press, the Refuge Press, which looks at really humanitarian voices and opinions in the humanitarian sector, as well as our International Humanitarian Affairs series. We also run exhibitions, lectures, symposia, etc. Throughout this fall, we will be offering a good number of webinars and speeches on topical subjects, and this is the first of them. It gives me great pleasure to first introduce Jesuit Refugee Service. JRS has been a partner of ours for over 20 years, where we have collaborated together on training, and especially in education in emergencies, a research project that we've been working in Chad, Lebanon, and Myanmar for the last 3 years. Jesuit Refugee Service is an international Catholic organization with a mission to accompany, serve, and advocate on behalf of refugees and other forcibly displaced persons, that they may heal, learn, and determine their own future. JRS programs are currently found in 56 countries, serving refugees and other forcibly displaced persons in conflict zones and detention centers, on remote borders, and in busy cities. They run pastoral care and psychosocial support programs in detention centers and refugee camps, and provide humanitarian relief in emergency displacement situations. Education and livelihoods programs provide skill development and opportunities for integration into host communities. They never cease, and I will emphasize this, they never cease to advocate for the rights of refugees and to articulate the obligation to protect the most vulnerable among all of us. Those in JRS accompany, and I'm proud to work with them. Today, we are thrilled to welcome Danielle Vella. With almost 20 years of service to JRS, Danielle brings an incredible depth of knowledge and experience serving forcibly displaced people. She's worked throughout the world to help refugees, and she works currently for JRS as the Director of Reconciliation and Social Cohesion, where she leads the organization's efforts to build bridges and create spaces of hospitality and welcome for refugees in host communities with the JRS teams around the world. As a journalist, she has also served as publication coordinator for JRS, editor and writer for the African Jesuit AIDS Network, and Canadian Jesuit International, with whom we've also worked. She's been a reporter for Vatican Radio and a contributor to the tablet Times of Malta and Asia News. She's based in Malta, although I know in her pre-COVID times, she was really based mostly traveling between crisis to crisis. And she's speaking to us from Malta now. She'll talk today about how COVID-19 has aggravated the challenges faced by asylum seekers to access their right to protection by adding more layers of discrimination and hardship to what was already a huge struggle. Danielle brings a global and local perspective, and I'm just, again, thrilled that we can start this fall off with JRS and with Danielle, my friend. So Danielle, I will turn it over to you for your remarks, and then we'll take it from there. Thank you.
Brandon, thank you very much. Thank you for having me here. So last year, I wrote a book of stories of refugees called Dying to Live. So when I was asked to give this presentation, I decided to get in touch with some of the refugees who I had interviewed to see how they were faring at this time. And I'd say that what I heard was a mixed bag. So there are some who are not all that impacted and who are managing to get on with their lives. So for example, there was a refugee from Afghanistan called Ahmed, who lives in Rome. And he did suffer during lockdown because the Afghan embassy where he works as an interpreter was shut down for some time. So it was only thanks to the help of some Italian friends who gave him some money to pay rent and buy food for his family that he was able to get by. But now he says he's gone back to work, the embassy is open again, and he's more or less going back to a normal life. Others have not been so fortunate, so I also caught up with Martin, an ex-child soldier from South Sudan, who I met as a refugee in Uganda in the north when I interviewed him for the book. And at the time, his life was really at risk. He continued to be too close to the border, so he was at the real risk of re-abduction. It happened. And also there was the stigma of what he had done. So life really began to look up for Martin when he managed to go to Kampala, where he was sponsored to study in a technical institute. And he was so happy at this second chance in life. Until COVID came along and the institute had to close, and now he's really not in the good space that he was. Another refugee from South Sudan who I met and interviewed in Uganda when I was writing the book is Matthew. Now Matthew, when I interviewed him, had told me all about his dream come true. And what was this? His dream had been to open a community school, a high school, in the refugee settlements where he lived. Now, this really wasn't something easy to do, but he managed in record time. And he did so because he had a dream that when these young people from South Sudan went back home, they would build a South Sudan that went beyond ethnic differences. So he wanted a school to teach peace. And he wanted a school to save the refugee youth from the enforced idleness, which opened them up to so many risks. So when I met Matthew, he was happy. His school was competing really well in the district exams, despite the big limitations it faced. And it was also really good for peaceful coexistence with the host community, whose children could also enroll there. And then COVID closed his school. So now Matthew is watching and worrying as young boys, drink and abuse drugs in the camp and play cards all day, nothing else to do. He says cases of theft have gone up because some young boys are forced to resort to stealing chickens and goats and to sell them to survive. He says many young girls who were in class in his high school before the pandemic have now got married and dropped out. Teenage pregnancies are on the rise. And what he says is, when he's talking about this, they look that there is no future, these youth now, because of the pandemic. For him, these days, the sight of his empty school makes Matthew really sad. He says when the students were there, it was so clean, so full of life. And now he says it's overgrown, the plants are overgrown, It has financial problems because the nominal fee paid by the students is no longer being paid. Teachers are draining out because they haven't been paid since March. So now they're moving on to find other jobs. And Matthew knows that when the time comes to reopen the school, he's going to face a really hefty cost to pay for the standard operating procedures for COVID, to buy the hand sanitizers, to buy the temperature gun and whatever's needed. These for him are going to be big costs that weigh heavy on his mind. Matthew is feeling the pinch in his own life. So sometimes he goes without his midday meal because market prices have skyrocketed since COVID at a time when the refugee food and cash rations are being cut. Another loss is that he says the freedom of movement is not so much there. And even if it was, now having to travel from one place to the next has become so expensive for the refugees. Interestingly, the thing he mentioned, like when he was asked, okay, what is the biggest impact for you? The first thing that Matthew mentioned over and above the material hardships was the spiritual one. He said, you know, we can no longer meet in church to pray. And he said, now, as he sees it, the trauma that the refugees faced back home is coming back to them because they miss so much the consolation that those prayer services used to offer. Something else that Matthew also highlighted, and this is something we have seen in many other places as well, and it's something we see in the refugee settlements in northern Uganda, because we are present in a few with education and reconciliation work, is that COVID has aggravated some of the tensions that were there existing amongst the refugees themselves and also between refugees and host communities. There are so many of them, like just to give a few examples. Recovered COVID patients, as in many other parts of the world, face stigma. There was a time, especially at the start, that those who were suspected of having the coronavirus risked being under attack, especially if they wanted to move from one settlement to another one. So that suspicion was there. Mistrust also grew when the authorities kind of told the neighbors to tell on each other if there were violations of the curfew and of social distancing rules. Gender-based violence really increased, and this was linked to, of course, being at home, being unable to work, increased alcohol consumption. And many of these things, many of these tensions would have been there, at least to some extent, but what COVID did is it aggravated them. I also contacted another young man, this time from Eritrea. So Fanuel is now about, I think, 25 years old, and he has been a refugee in a camp in northern Ethiopia for the past 7 years, living on his own. So what he says is that COVID has made a situation that was already intolerable even more so. So when I had interviewed him for the book, Fanuel was trying his best to keep his hope somehow there and to try to cope with the poor prospects offered by camp life. And he was fighting the temptation to take off for the deadly journey across the desert and across the Mediterranean to try to reach the EU. When I contacted him now, he said, and I'm going to read it, "As you know, life has always been like a lockdown and full of uncertainty in this refugee camp, even before COVID-19 outbreak. Now it's only getting closer to materialize our fears. For all these years, I've been struggling, hoping that next year things will be okay. Now, this pandemic has made everything beyond my capacity to bear." In concrete terms, what the pandemic means for this young man is that he's lost his job. He had a job as a para-counselor with an NGO, but when the funding for that project stalled because of COVID, he lost, as he says, his reason to get up in the morning, his connection with the rest of the community. He lost what kept his suicidal thoughts at bay. Something else he said, which I found interesting, is that the refugees who before used to be the envy of the camp because they were receiving remittances from relatives and friends who had already reached wealthier places. But now some of those benefactors could no longer send money because they themselves had lost their jobs, again, due to COVID. Now, it's really difficult to speak in a general sense about the impact of COVID on refugees because, of course, every story is unique unto itself of the millions of refugees and other forcibly displaced people in our world, and fates and contexts differ widely. However, we do see, at least I do see some kind of common threads, even in the stories I just shared, and in what we've been hearing as we go through these months. And the way I see it is that COVID really has the potential to add this extra layer of hardship, insecurity, injustice, discrimination to situations that were already pretty bad. And of course, then to make them worse. So around the world, we are seeing how really the daily struggle of survival for refugees is becoming worse and worse, harder and harder. So we hear, for example, that medical treatment is that much harder to come across. We hear how work opportunities have shrunk. So in many places in the world, refugees often end up working on the black market because they have no other choice. And even if they don't, the jobs they find tend to be very precarious, often for a short specific time frame or seasonal, like working in the tourism industry or in agriculture, being carers or cleaners in people's homes. With COVID, tons of these jobs and opportunities just disappeared. Someone who works for JRS in Malta, where I am from, told me that when the pandemic started, the rise in the number of people coming to ask for help to pay their rent, to put food on the table, was scary. That was the word that she used. Now, it's really important to say that it's not only refugees who have been affected by COVID in this way, of course. They are far from the only people to lose their jobs, to not have rent to pay, to end up queuing for food. However, refugees are arguably even more precarious because the nature of their situation can be so fragile, and even the wellness that they reach too. And why? Because they tend to have a lot less to fall back on. They don't have that safety net, which perhaps others might have in terms of maybe savings or relatives or friends who can afford to help them, or other support networks like that. And those who are without any access to protection at all are frequently the worst off because they don't have any benefits that can keep them afloat. So something like COVID can really blow their world up. In the UK, JRS works with asylum seekers who are already really vulnerable. So they're already either destitute as a result of the system or in immigration detention. And they really depend on the charities to keep themselves going from day to day. If they didn't get help from charities, from NGOs, they could not move from one day to the next. And this is what happened when COVID suddenly broke out. They had no cash. They used to live, many of them, sleeping in the homes of friends. But when the lockdown came, they found themselves on the streets with no food. They went immediately into crisis. In Malta, the biggest open center that we have, so an open center is a place where hundreds of refugees live. When the pandemic came, it suddenly closed. So imagine what happened to the people who were stuck in there. Those who had jobs and who had just suddenly started to rebuild their lives, they lost them, just like that, with no warning. So I would say, however, that the most visible sign of how refugees, not all, some, of how some refugees in Malta were impacted by the pandemic was the way the government started to treat arrivals by boat. So Malta is a border state of the EU, right? So basically, we're at the border, at one of the borders between Europe and Africa. So boats leaving from Libya, those overcrowded, flimsy boats, which the smugglers send with people who are desperate to try to reach Italy, many of them end up in trouble in Malta's waters. So now it's always a topical issue, and if you follow the news now, we can all see what a topical issue it is. Who is going to rescue this boat? Which EU state is going to rescue this boat and implicitly take responsibility? But what the government did when COVID came is it said it flatly refused to rescue boats in its search and rescue area. And it cited the pandemic as an emergency. And it used it basically as a pretext to derogate from its sacrosanct international obligation to save lives. It insisted in this stand, and the results for refugees, they paid a very high price. So in one of the incidents, after a boat had been stranded at sea for days, 5 people were found dead on board. Another 7 were gone. They were presumed dead. They had fallen overboard. The remaining 51 were taken back to Libya, where they were detained directly in conditions we know very well are cruel and inhumane. Another practice that our government is resorting to is putting some of the refugees who come on tourist boats, those boats which normally take tourists around the island. They're squashing them there, keeping them captive. And here we see another trend of COVID, how it's serving really as a pretext for governments to further deny access to protection to refugees and to really continuing imposing restrictions on them. This, of course, is not only here. The UN has said that thousands of refugees have been pushed back or deported to dangerous environments since the corona crisis started. And just recently, JRS USA issued a statement about the fact that more than 159,000 migrants and asylum seekers were expelled from the US southern border as a result of travel and asylum restrictions implemented since March in response to the corona crisis. We can speak more and more of signs of how this is happening, how COVID is serving as a pretext. We see, for example, anecdotally, how detention has increased in length now in some places, or it's become even more confining than it used to be. Access of NGOs to centers where migrants and refugees and asylum seekers live, whether these centers are open or closed, this access has become more restricted. So it really increases the isolation which is faced by the refugees. And it means they don't have access to information, to support, to advice. And the restriction on freedom of movement, which is so difficult for all of us to bear in this time, no? But really for refugees, it's really especially hard, not least because many of them are warehoused in really overcrowded conditions, and also because they had already a priori been facing restrictions to a greater or lesser extent. So the added restrictions of COVID could really be push people over in their frustration and despair. And here I want to talk about another island, another border of the EU, which recently was in the news, the island of Lesbos in Greece, which became the focus of international attention when a fire devastated most of Moria camp, which housed most of the refugees on the island. Now, when I was preparing for this presentation, I talked to a resident of Lesbos, a volunteer who for years has been helping the refugees there. And he described the arson attack as a reaction to the authorities' attempt to put more refugees in quarantine. And what he said was that now it was the reaction of a handful, of course. And he said that many of the refugees in Moria camp felt that COVID was just an excuse of the government to make life harder for them. Like they were really convinced, as many other people are, that COVID does not exist. Now, of course, COVID does exist. However, as my friend argued, the refugees were right to the extent that the pandemic gave the Greek government the excuse to do what it had wanted to do all along, which was to make this camp a closed one. In fact, it had tried to do so earlier in the year, but had failed, and then COVID came along. Now, I'm not saying that the fire there was solely the result of COVID? Of course not. So the horrible plight of refugees stranded in Lesbos as a direct result of EU asylum policy has long been condemned by human rights groups and by NGOs. In fact, a statement issued by JRS after the fire clearly says, overcrowded and undignified, the conditions of Moria camp had become over the past years a tragic symbol of current European policy that is unable and seemingly unwilling to provide decent and safe conditions for refugees. The inhumane situation in which thousands of asylum seekers were stranded at the gates of the EU should have been solved long ago. Well, it wasn't. And then COVID added that extra layer of justice, injustice, and of tensions, and pushed to boiling point a situation which had been deteriorating for a long time. And again, it is the way that the authorities handled the situation which also really made things worse. Because when COVID appeared in Lesbos earlier in the year, as everywhere else, the whole island went into lockdown. But then, when the restrictions around the island started to be taken off, they were kept in the camp, extended 2 weeks after 2 weeks, although there was not one single case found in the camp. So it was like one rule for everyone else and one rule for the camp. Then what happened? They found one case and they closed the camp. And the rest, we know what happened. Something else we see in Lesbos as well, and this again we see in many other countries around the world, is how COVID is serving as an opportunity for some people to whip up anti-refugee sentiments. And again, to quote my friend, the whole thing seems to play on two fears: fears of COVID and fears of the refugees. And so much the worse for refugees and the protection they are entitled to. And by protection, I don't mean only getting that precious piece of paper, that document that gives some kind of status. You're a refugee, you have humanitarian protection, you have subsidiary, whatever. I don't mean only the physical safety of sitting in a refugee camp away from home. Some years ago, JRS Malta ran a really nice project, I think it was, for women in immigration detention whose application for asylum had been turned down. So we did a project with them, and it was really to enable themselves to become agents of change in their own lives and in the lives of the communities around them. And they defined protection in a very specific way. And they said, you know, this is for us what protection is, not just a piece of paper. It is becoming part of a community in which everyone in that community, whoever they are and wherever they come from, can live life to the full. That means they can live in dignity, self-sufficiency, look after their families, and where they can belong, give and take. Now, COVID really threatens this sense of protection because it is being used all too often to further the isolation and stereotyping of refugees, to further restrict their freedoms, to make their access to basic services more difficult. And of course, it makes their struggle for survival that much harder. Now, very briefly to end, what is JRS doing in all of this? So across the world, our response unfolds in different ways. I'm surely not aware what our teams in all the countries where we are present are doing. But what I can say is that we are really doing our best, I believe, to see that refugees get the protection that they need at this time. So, and this translates in different ways in different places. In places like less, for example, less for a refugee mitigate the tensions that can be of a very concrete order, like we have acquired megaphones, which the leaders can use, for example, the religious leaders, to appeal to their congregants not to gather for prayer, but to pray at home. In one place, we organized a radio, a series of radio broadcasts, so the leaders could still have a way to reach their people. We are especially attentive to ways in which the virus can increase inequalities, even among refugee communities themselves. So, for example, in one camp for Somali refugees in Ethiopia, we are present and we have access to the quarantine areas. And our focus there is helping people who are especially vulnerable, who don't have the food and hygiene items they need, but also to ensure that that one particular group among the refugees, which is viewed as inferior by the rest, is not discriminated against. And insofar as we can, yes, we give the refugees emergency supplies of food, we give them the means to protect themselves against COVID, water, soap, which are very short supply at times. I think we forget about this, how basic it can be, but how many people don't have access to that, and yet they're being told, to do what they can not to get this virus. And all this we do and much more in the context of our mission to accompany refugees, which is the cornerstone of our mission. And two things I heard, which I really liked, of how we're trying to be creative in doing this. So where we can, we're present on the ground, but many times we cannot be. Like, for example, in the UK, JRS set up a phone, emotional and support system run by elderly volunteers from around the country who cannot be doing more hands-on work. Or they're trying to do community events like cooking on Zoom or social distancing picnics, just not to lose that sense of community that they've tried so hard to build with the refugees over the years. There's much more I can say, but I'm going to stop here. And to offer just a closing reflection, I think that while COVID, yes, it's my belief, definitely presents a very clear threat to refugees, to some of them in any case, many of them, and can make life much harder for them. I believe it could also be an opportunity to make things better, because it is shining a spotlight on injustices and hardships. It is amplifying them in a way. So now, and bringing them out more into the open. So now might just be the time to call for change at community, national and international levels. So if we can, hard as it is, not to let it pass us by. Thank you.
Thank you very much for that, Danielle. Especially the ending, you really tied things together so beautifully. As with so much in the humanitarian sector, we've had to be creative. I would like to press you a little bit more about really the opportunities that have been presented, I would say, because of COVID. I mean, we know about the tragedies, but how we can act creatively and differently, especially how JRS has reacted since COVID to accomplish its mission in a creative fashion. Could you speak a little bit more about that?
Okay, thank you. I think it's, yes, there have been opportunities presented by like a COVID, and I'm going to just say a few that come to mind. So I'm going back to the JRS in the UK, where until COVID came along, most of the volunteers tended to be older. So they would tend to be retired, lay people, members of religious congregations who were giving their time. But when COVID came, it was difficult to engage them in doing this work because it presented a risk for them. So what JRS did, it had to recruit a whole new body of volunteers who were much younger. So this was an opportunity to reach a whole new group of people who were who really wanted to help and who became involved in a whole delivery system that was set up because JRS used to have a day center where the refugees used to come. Now, of course, this was no longer possible. So they managed to set up in a really short amount of time a system of delivering food packages, hygiene items, and really doing really imaginative things. That's one place. Something that we have done, like, for example, as the Reconciliation Project, is, okay, we could no longer go to the field to do workshops in the field. So we did a series of webinars in which we invited the many resource persons from different academic, religious, and cultural backgrounds who have been helping us in this reconciliation program. So we got, like, we made a whole series of training for our reconciliation coordinators and other staff in the field. And I think this, okay, it's really tricky. I would not choose online over on-site, but, you know, we managed, and we could see that there were benefits of that. Something else that we've seen also is, you know, we do have a lot of members of refugee and host communities on our staff. And basically, since many people who are expats could not be going out, were under lockdown, we really left it up to them to take ahead the projects in the field, you know. And I think in a way they really came into their own, and it was that was something that was really good. Also, a lot of our projects build the capacity of people in the community, like religious leaders, community leaders, and women and youth. And once again, we just found ways to support them to be able to do this work. Like, you know, I mentioned the example of the radio show, the megaphones and all this kind of thing. But there's, and much more than that. And I think an opportunity presented by COVID, so in many ways it is divisive, it's been divisive, but it's also provided an opportunity to do something together for the common good, over and above the things that pull us apart. And this is something that we have seen. I think if, you know, in those places where we had focused on building relationships amongst the divided groups before, we saw the fruit of that, in that people really did try to come together to mitigate the tensions that were there now with COVID, and to do something for the common good. So I've just mentioned a few examples, but I think that looking in the long term, we need really again to be looking at what the opportunities, what the needs and opportunities thrown up by the coronavirus are, and to see how we're going to really take them on board in our missions.
The first is from Marshall, who asks in part, do you think that COVID-19 has caused a global shift in the way that asylum seekers are viewed and are treated? So, just in itself, you covered this a bit in your remarks as well.
I think, yes, there are signs of it, as I said in my presentation. So I think, again, I come back to this metaphor. For me, it makes a lot of sense, of this layer, you know. So if already there was some suspicion and mistrust or resentment, I think it served to amplify them. Let me give an example from Malta again. So there was a time when one of the boatloads that came was tested. They're all tested, but in this particular boatload, a very high percentage of the refugees there, I don't remember exactly how many, I think it was 60 something, were positive. They tested positive. Now there are many reasons for that. Like maybe the fact that they had been stranded in an overcrowded boat at sea for days, or they had been imprisoned in a Libyan prison before coming here where disease is rife. Anyway, this was the case. So the comments on social media that were flying around were really negative, you know, to the tune of why don't they all go back to where they came from. Now, there's always been a strong trend of thought like that, but this amplified it. In other countries, yes, I think it has been the same.
Another question on that came in right now. International organizations and NGOs have seen funding cut as countries prioritize humanitarian budgets to deal with the impact of the pandemic. Could you talk on how, in your opinion, resources can be ensured and used more efficiently in times of COVID-19?
I think, yes, it's definitely a reality that, yes, budgets have been cut, but also budgets are being diverted. So now, like, you know, I think a lot of the focus, donors, when they issue proposals calling for funding is really on COVID. You know, that it's something that has to be really woven into the way that we respond. That this is how it should be, not just because it's a call, but it's there. So suppose if there's a shift one way, take resources from something else. So what I would say is that whether COVID is there or not, we should always be trying our best to use resources very efficiently, but also to see, I think this is a time where we cannot just, I mean, much as we'd like to, we cannot just try to say, oh, let's try to keep doing things the way we've been doing that. So like the example I gave of JRS in the UK, where from a day center they shifted to a delivery service, and they made hubs in parishes where small numbers of the refugees can meet. We need to be looking at ways of integrating a COVID. I would not, for me, what I want to emphasize is I don't think, sometimes there might be a temptation to become COVID exclusive. And I don't think we should be doing that, because COVID adds to what is already there. You know, this is what I mean. So we need to have a COVID inclusive response that, yes, of course, really makes good use of the funds that we get. But there does need to be this orientation.
So, which leads perfectly into the next question, which is, this is from Christophe Lobry-Boulanger of the IFRC. What about the nexus between the humanitarian work and legal work assisting refugees and migrants? In that sense, could COVID be a disaster for the humanitarian domain, but an opportunity from the legal perspective? And how does JRS go about destigmatizing COVID? So it's a number of questions in one.
Number of questions in one. Yes. So,
this is why you're paid the big money.
I wish I was. So let me go to the destigmatizing part first. So I'm going to refer to it again, sorry for the third time, but it is a very good example. So in Uganda, in the north, yes, one of the things we saw was the stigma targeting recovered COVID patients. So this is how the idea came to do one of the ideas that led to a series of radio broadcasts. And radio is still a very effective medium in rural settings like that. Really to talk about this, you know, to get recovered patients to speak about their experience, to get doctors to speak, to discuss the whole issue, and to discuss it also from a religious perspective, not only from a health perspective, but social, religious, and other perspectives. Also, we are doing a lot of awareness campaigns in the camps. That's really something we're doing very much of too. Going back to the other questions, is COVID an opportunity from a legal perspective? I'm not so sure. And again, I don't think we can tell yet. So I was speaking to a colleague in France, again, when I was preparing this presentation, and I was saying, look, how does it look? You know, how is COVID impacting? And he said, you know, what we're saying is that we might be able to tell 1 year from now, but now it's too difficult to see. So one good thing, for example, is that at first they took asylum seekers off the streets because they posed a risk. And at that time, they did more registration of asylum seekers, if I understood well. But what we're seeing more actually is that the access to the asylum process has suffered because of COVID, simply also because so many offices, especially in the period of the lockdown, closed. So it has made practical access to asylum harder at this point, not easier. But again, I cannot say that this answer applies for all. This answer applies to what I have heard.
Of course. A slight variation on that really is, and again, going back to what you had spoken about earlier, this time from Dr. Tony Land, who spoke a couple of weeks ago to us as well. So what Tony raises is we're all having to work in a new normal in this COVID situation. What changes in the treatment of refugees do you feel are appropriate in this situation? And perhaps there I might add on to Tony's, what is JRS changing in their treatment?
In the treatment of refugees, you mean in the services
right.
that are offered? Yes, okay. So I think something that JRS has done from the very start is really to try to kind of deal with the onset of the pandemic, even at a strategic level, at an international level. So we came up with a list of guidelines for the different sectors where we are at work. So in education, reconciliation, psychosocial, livelihoods, and advocacy. We came up with a kind of scenario, what to do now in the emergency phase, what we should be looking at in the midterm phase, and what we should be looking at in the long-term phase. Okay, so that's kind of served as a, and I think this is not something which is a document which is written in stone. It's something that keeps changing as we move. One of the comments of the international director of JRS that really stayed with me, of Father Tom Smolich, was that he had written in one of the letters he sent out to us saying, look, you know, when kind of the dust settles after this coronavirus, whenever that is going to be, and even as the dust is settling down, there are going to be so many people, so many refugees who are left behind, and it's going to be those who are more vulnerable, like the ones I was mentioning in my presentation. And our mission is really always to be those refugees who are most forgotten, not attended to by others, and who are vulnerable. So I'm wary of using this word, okay, but I'm using it now because really to try to explain what I want to say. I would say that is one thing, but then I would say also, you know, in those areas of education and livelihoods, how are we still going to enable people to access those opportunities they so badly need, like Martin, the child soldier I mentioned earlier? How are we going to work with like Matthew, who wants to reopen his school, to really help people to, despite, like, how are we going to learn how to exist in this new normal in such a way that we live, you know, and we can help the refugees to continue living as well. What I can say, one final word, and this is about reconciliation, which I leave to last because it's my, otherwise I'd go on just on that, is that we see that the virus has really kind of increased the need for reconciliation because of the tensions and the conflicts that were already there, which it has aggravated. And in some extent, you know, maybe also some new things that have come about as a result. So we see the increased need, and we see the need to invest more and more in building the capacity of communities on the ground, of accompanying them, of building their capacity, so then they can really have services that they sustain themselves. This is the ultimate aim of everything that we do.
This one is on a question about, is there a platform that you are using, looking at the level of linkages and openness for information sharing and management? You know, I guess this question really is not only from JRS internally, but JRS and other peer institutions that are working with asylum seekers and refugees. do you find a greater openness or a new linkage during these COVID times?
You mean of working with other NGOs?
That's how I'm reading the question. It's not my question.
Right. I think, I mean, again, I can come at this from the reconciliation perspective. And I think that, yes, I think there is this, and I think there are efforts to really increase this. So I'm thinking, for example, about Religions for Peace, the international organization, and really the focus of Religions for Peace at this time. So they're giving seed funding for COVID-19 interventions across the world, and their aim really is to get different faiths and so organizations from different faiths to present a common response to the pandemic. This is something they're really trying to do. For us in the reconciliation work that we do, we really try to prioritize working with different organizations, universities very much, not only organizations. Okay, and because of the opportunity to do now things online, we have to do things online because there is no other way. This has also somehow proved a way to bring people into the training we're doing, the capacity building we're doing, the evaluation that we're doing. So that's there as well. On the ground, what I would say is that even within JRS itself, it's really been a way of getting the different projects to really work together to present a united response to the pandemic. So it's been really good to see that.
Danielle, a question from me on this, which is, how do you and how does JRS measure their own effectiveness? I mean, I would tell you that one of the things that we've struggled with as an institute is having an impact on our communities, and we've looked to bring things online. We've looked to have webinars. We've looked to operate with the opportunities that are given to us right now. But I know it's frustrating. It's frustrating for me, and I'm sure it's frustrating for you to do all this from your home.
Deeply so.
And so could you speak more about that frustration and how you measure the impact of your work and the effectiveness during this time?
Okay, the impact. So again, I'm going to take the example of the reconciliation program that I run. And what we're doing is we took a decision earlier on to base the monitoring of this work that we do and the evaluation on the principles that guide our work. So we have principles that guide our work of reconciliation, that inspire, guide everything we do in practical ways. So we want to see the projects we're doing on the ground, do they adhere to the principles, which they can adapt to their context as they wish? And is that helping us get the results we want to get? Now, we couldn't go and do this on the ground. We couldn't go and have focus group discussions, do one-on-one interviews, do case studies. It was all planned, it was all shelved. So what we're doing is we're working with a consultant in this principles-based approach, and we're getting together the reconciliation coordinators of the projects that we're evaluating, and we're going on a kind of journey online over 6 months where we look at each of the 5 principles that we have, okay, which are about for example, to prioritize the value of the humanity that we share, to work for a justice that restores relationships, to have participation really on board in what we do. So we're going through principle by principle and then looking at our work through the lens of each one. I have to say, so far, given all the limitations posed by an online setting when you're working with people in remote places where sometimes the internet is a disaster, I think it's still proving to be a really good exercise because somehow people are really able to reflect on their work in a way that is giving them more insights in where they are and where they need to be going. And a lot of stories are coming out. And the storytelling aspect is one I find the most effective in really sharing, seeing the effectiveness of what we've done. Of course, we want to spread it out. We want to listen to what all the stakeholders say, you know, all our community partners. That's going to have to wait. But at least I feel we're at least engaging on this internal journey, which is helping us as a team to grow and to do our work better. I don't know if that makes sense. But...
Thank you. So this follows on from that, which is the future of reconciliation work, which you've just been talking about. How do you see the future of reconciliation work, you know, proceeding? But also, what would be a separate question? What would be the best coping strategies urban refugees would use to mitigate the effects of COVID-19? So quite specific in your work with urban refugees.
Mm-hmm. Cool. So let me answer the reconciliation program first. Where do I see this work going? I mean, really, as I said earlier, I think the impact of COVID has really brought about a need for more work on reconciliation. Put briefly, our vision for reconciliation, which is deeply faith-based, is to recreate right relationships, and specifically amongst refugees themselves, between refugees and host communities, and also among our own teams, which as often as not are a microcosm of the contexts where they come from. So we find ourselves working a lot with identity-based differences that can become divisions, and now with like of COVID, as I said, many of the tensions that were there, many of the conflicts that were there, that extra layer is there. So there's so much to do. So where I see it going is really to keep building on what we're doing and to face the challenge of working on reconciliation programs when we cannot bring people together in groups. That's going to be a challenge. But again, we look creatively into the future for what we can do at this time. Urban refugees in coping with COVID. I was mentioning a lot of the challenges that they face now in the talk that I gave, especially the access to jobs, to very precarious jobs, which are shrinking now, to rent, to not having sometimes enough food. So really, at this time, many are really having to turn more and more to NGOs for material help to get by. There's no other way around it. So what I think we need to be looking at is ways to help them perhaps to access jobs in the current market, which they can, which will be open to them, to identify and to find jobs that will be open for them, to identify more accommodation possibilities, perhaps in partnership also with church and other NGOs. But there is really, it's tough. I'm afraid I don't have any easy answers because the situation really is tough, and money will be there for COVID emergency, you know. Not so much money might be available for those services we need to continue giving, you know, like the legal aid. That's going to remain there, you know, the help to find the jobs, the English language classes, and there's always going to be a number of refugees who will always need our support and help. So a big challenge, I think, is to find the funding, not just for the COVID emergency part, but also for all the services that we need to give, especially with the increased refugee challenges that the refugees face.
Last question coming from The Hague, which is, are there youth-specific ideas that you would point out, such as the distribution of soccer balls? And I assume this is in the context of the mitigation of mental health issues and enjoyment.
So around the world, a lot of the projects that we have are specifically with youth. Okay, so we have youth the exact word isn't coming to my mind now, but projects which are basically recreational, especially in places where there is not so much opportunity to study and to work. So there's sport and drama, music, there is psychosocial programs geared at youth who face so much frustration being in refugee condition. What I can say is that whatever plans we are coming up with now, of course, have to be in line with with things that we can do. And in many of the places, or rather in some of the places that we work, like in the middle of the camp, we have the compounds where the youth can come and just be there. Of course, as I said now, in respect of social distancing rules. In the reconciliation program, something that we do is we have a specific focus on youth, because we see in the conflict assessments that we do that they are often seen, rightly or wrongly, as spoilers of the peace, you know. So, and not only because of that, I mean, they don't have, those who are out of school, there is nothing for them, you know. So we've really focused on building the capacity to be agents of change in their communities. And in this time of COVID, we really saw I think the fruit of this, because they really did come to their own. So we were building their skills. And again, this is a focus of what we do, whether through livelihood programs, education, adult literacy, the leadership and peace building work. So building their skills and really equipping them to become agents of change in their communities.
Danielle, that's the conclusion of the questions part. I wanted to save just a little bit of time for any concluding remarks you might have. But before you do, I do want to thank you for your transparency and for the passion that you've given in this speech. And I know it's quite clear how personal it is for you. This mission is your mission as well. So, you know, before I turn it over to you, I want to thank you, and I want to thank your colleagues that I'm looking at from around the world at JRS for the time that you've taken to be with us today. And again, your ability to just open up about it. Again, thank you, Danielle. Thank you, Josh. And last words to you, Danielle, and then I'll turn to Camille.
Okay, no, I think I've talked quite enough. I don't really have much to say except thank you for having me here. I just want to say that the examples I shared, everything I said, cannot do justice, one, to the very diverse plight of refugees and asylum seekers in the world of COVID, and also not even justice to the big work being done by the JRS. So if there's anyone of the JRS who was there saying, oh, why didn't you say this, or why didn't you say that? I'm very sorry. But definitely, I hope that this has been a good session for all of you, and thank you for having me here. It's been good for me to share. So thank you very much.